Welcome. Thank you for joining us for Obesity Care Week 2022. Now is the time to act. I am James Zervios, Obesity Action Coalition Vice President of Marketing and Communications, and I'm very excited to be here with you today. Today we have an insightful and engaging discussion planned with two of the most sought-after experts in the field of weight bias and stigma. But before we get started, we would like to recognize all of our OCW2022 supporters. We would like to thank all of the champion organizations for supporting us all across the world this week. And we would like to thank all of our OCW 2022 partners, our bronze partner, Eli Lilly, our patron partner, EndoPharma, and our supporting partners, Boehringer Ingelheim, Celebrate Nutritional Supplements, Curax Pharmaceuticals, Fujifilm, Intuitive Surgical, and Rhythm Pharmaceuticals. Thank you to all of our distinguished partners and champions. Without your support, Obesity Care Week would not be possible. People often ask me, what is one of the most difficult aspects of working in patient advocacy? My answer is simple: weight bias. Weight bias is one of the last acceptable forms of discrimination in today's society and is often present in all areas of life for people with obesity. Today, we are fortunate to have with us Dr. Rebecca Puhl and published author and registered pharmacist Ted Kyle to help us dive into the topic of weight bias and provide thoughtful discussion. Dr. Rebecca Puhl is Professor of Human Development and Family Sciences and the Deputy Director of the Rudd Center for Food Policy and Health at the University of Connecticut. She is a national research expert on the topic of weight bias and discrimination and has been studying this issue for 2 decades. Ted Kyle is a tireless advocate for people living with obesity and published author on the topic of weight bias. His widely read daily commentary, published at ConscienHealth.org/news, reaches an audience of more than 15,000 thought leaders in health and obesity. Welcome, Dr. Puhl. Welcome, Ted. Thank you for being here today.
Thanks for having me.
Thank you so much for having me.
All right, let's get this tough question right out of the way first. Is weight bias improving in the U.S.?
Well, if we look at prevalence rates that are reported in research studies, we see that at least 40% of American adults have been stigmatized about their weight, and so far the numbers aren't really going down. At the same time, I do think that awareness of weight bias is certainly improving, and it's much more on the radar. It's much more in social consciousness than it has been in the past, so that's very optimistic. I also think that there's been really an increased recognition of the complexity of body weight and obesity, and that this is not just an issue of eating less or being more active, and I think that understanding is also helping to raise awareness of this issue.
And I think what I'd add to that, Rebecca, is the research out of the Harvard Implicit Project a few years ago really impressed me in the story that it told that explicit bias about weight seems to be trending down a bit, but implicit bias for weight has actually trended up while that's happened. And that reflects my own anecdotal experience, that I hear people say things like, oh yeah, I don't want to be biased again. I don't want to say unacceptable things. Fat shaming is not okay. But then the implicit things that we do, the attitudes that we bring to the subject, they just don't seem to be getting much better, even in a context where we're trying to be a little bit more sensitive to the attitudes that we bring.
So Ted, I have a question. So, we constantly hear of reports of weight bias in healthcare. People are going into the healthcare provider's office. They're being faced with weight bias. Shouldn't that be the one place where someone with obesity should feel most comfortable and not really be afraid of that conversation or the interaction?
Absolutely, yes. Unfortunately, that's not true. And it's not true because health professionals are just human beings like everybody else. And they bring the same attitudes that are prevalent in our culture into the conversations. And unfortunately, the understanding of obesity and what it is that it is a biological problem and not a character problem, is not, that understanding is just not the default in our culture. And we really need to do something about that, I think.
Yeah, I totally agree with you, Ted. I think we need to remember that being a medical professional doesn't make you immune to weight bias. And like you were saying, you know, we're all in the same society where weight bias is really ingrained in the societal fabric and part of our culture. So I think it's unreasonable and unfortunate to expect that we're going to enter a bias-free environment in healthcare. I think the other thing to mention here is that it's important to acknowledge that medical training on topics of obesity and nutrition are often inadequate, and issues of weight bias are rarely, if ever, being included in medical school curriculum. So that can also contribute to one of the reasons why healthcare is a setting where weight bias is present.
Yeah, Dr. Puhl, you talked a little bit there about culture and society, and I think one of the things that we've really seen become more prevalent throughout the past decade is the body positivity movement. You know, a lot of people have commented that the body positivity movement has contributed to obesity being more acceptable and bias lessening. Even some medical experts have claimed that this could be a bad thing with avoidance of care. You know, what do you think? Has the movement negatively affected people with obesity?
So the body positivity movement has helped to really elevate public awareness of weight bias in important ways, particularly on social media by calling out instances of weight bias or body shaming, promoting messages of self-acceptance. I don't think this movement has negatively impacted obesity. Body positivity doesn't mean ignoring or negating the importance of health. Body positivity really focuses on equality and acceptance for all body types and sizes and encourages people to care for their bodies. In contrast, we know that weight worsens health, and many factors contribute to obesity: food environment, biology, genetics, food access. I mean, the list goes on and on, but body positivity really isn't one of those factors.
And I have to say that when I hear someone say, isn't body positivity going to make obesity more acceptable? I think to myself, are you even listening to what you're saying? Because whoever talks about making cancer acceptable or making diabetes acceptable, if I have compassion for someone with heart disease, does that mean that I'm making heart disease acceptable? Where does that kind of thinking come from, except from implicit bias?
Yeah, Ted, I know that you're a published researcher. You've done a ton of research around weight bias, especially all over the world. I just have two questions for you. Is weight bias the same all around the world? And is the US the most biased?
Well, I would say two things, and I'm really eager to hear from Rebecca on this because she's done some wonderful research on this recently. But it's tough to compare bias across cultures because bias is so deeply ingrained in culture. Having said that, we do have a lot of bias here in the US, and looking at the attitudes of people in different countries, I would say that the only countries that seem to rival us are the UK and possibly Australia. Uh, but again, cross-cultural comparisons are a little bit challenging. Rebecca, I'd be really interested in your thoughts on that because I know you've done some cross-country research.
Yeah, weight bias is certainly present in many countries around the world. And our research found that the prevalence and sources and harms of weight stigma are pretty consistent across Western countries. So places in Europe, North America, as well as Australia. But I think it's important to recognize that body weight can mean different things and has different values in other places around the world. And we know much less about weight bias in low income and developing countries, for example. So it might not be the same all over the world, but it is certainly a problem in many places.
Dr. Puhl, I know you talked about how it's definitely a problem in many places, but to kind of dovetail off of that a little bit, do we see any differences in bias by age? Are kids more accepting than adults? I mean, what does the research show there?
So in research, we see that attitudes that lead to weight bias are already present in very young children, as young as preschool age. And those attitudes become learned very early. So by elementary school through high school, it really turns into bullying and victimization. And weight-based bullying is one of the most common forms of bullying that kids face. But then we know that weight bias continues throughout the lifespan, in adulthood, in middle age, where it's experienced more as systematic forms, unfair treatment and discrimination. Where less research has focused is on older adults, and whether weight bias is higher or lower in older age groups could be something that may be generational or could shift over time as societal attitudes start to change. So for example, as we continue to see more messages of body acceptance on social media platforms, that could help shift attitudes in young people to be more accepting and less stigmatizing. So we'll just have to see over time if those shifts take place.
And the only thing I would add to that is that I'm always real cautious about generalizations because, as Rebecca said, you can see evidence of weight bias in people at any age. I am getting some hope from the idea that younger people are getting positive messages about their bodies, and I think that has the potential for us to see future generations expressing less bias.
So, we've talked a lot about bias across the globe. We've talked about bias in different age groups and the body positivity movement and these cultural shifts and what we think it's going to take to start to see change. I guess my last question, I'll pose it to you, Dr. Puhl, first, and then Ted for any follow-up. For someone watching right now that is dealing with weight bias, whether it be in the workplace, in a healthcare office. We know there aren't a lot of legal protections for weight bias right now, and that's something that we aim to change. But what would you tell somebody right now who's experiencing weight bias and just is saying, I don't know what to do? What would you tell that person?
Well, first, I think it's important to say that you're not alone in this experience. And second, that you're not to blame. Too often people blame themselves for these experiences, which only makes matters worse. And I think what can be particularly difficult is weight bias can come from people that you see in your daily life, even from family members and friends. And it's often those experiences of stigma that can be most harmful and hurtful, and the ones that really stay with people over time. It really does take an emotional toll. So if you find yourself being stigmatized by someone because of your weight, I would say immediately just try to find a quiet place where you can process what's happened and how you feel about it, and then try to find some social support. Try to connect with a friend or a loved one that you know will be supportive. Talk to them about what has happened, how you're feeling about it, and talk through how you want to respond. Sometimes people respond by avoiding a person or a setting where they feel vulnerable to being stigmatized. But if stigma comes from a person in your life that is part of your life, it may be more helpful to really let that person know how their words or actions have impacted you and why it was unfair or inappropriate.
I just want to emphasize what Rebecca said about finding supportive relationships and building up those supportive relationships and building your life around people who can be a source of strength and support for you, so that your belief in yourself and the expectations that you have for the people around you are better. They're just people who believe in themselves that other people just aren't going to mess with. And I think you want to get to that strong, confident place as best you can. And when people are knocking that down, you have to ask yourself, is this relationship a positive force in my life?
Well, Dr. Puhl, Ted, thank you so much for your time today. This has been extremely enlightening, and I think we've talked about all the different ways that we want to see change, and I hopefully we will see that as we continue on. Thank you for being here for Obesity Care Week 2022. We greatly appreciate your time.
Thank you.
Thank you, James, so much, and thank you, Rebecca.
Thank you to both of you for today's discussion. It has truly been an enlightening talk, and we hope everyone watching has enjoyed it as well. Before we close today, we would like to once again thank all of our supporting champions. Thank you for everything that you've done for us for Obesity Care Week 2022. And we would like to thank our partners, our bronze partner, Eli Lilly, our patron partner, EndoPharma, and supporting partners, Boehringer Ingelheim, Celebrate Nutritional Supplements, Curax Pharmaceuticals, Fujifilm, Intuitive Surgical, and Rhythm Pharmaceuticals. If you haven't yet visited the Obesity Care Week website and learned how you can take action now, please do so by visiting obesitycareweek.org. Now is the time to act. Thank you very much.